today I'm going to talk about, as Jeff said, it also happens to boys. Most of the research that's been done on childhood sexual abuse has been done on this childhood sexual abuse of females. So it's, males have really been neglected. And although many of the after effects are similar, they're not all exactly the same. Certainly there's fear, lack of trust. You have this on your handout here. Fear of intimacy, anger, fear of powerlessness, depression, suicidal ideation, isolation, shame, stigma, low self-esteem, disturbing thoughts, PTSD, tendency towards re-victimization, addiction, eating disorders, and dissociative symptoms. Those are just a few. And both sexes can have these. But actually, male survivors are affected tremendously by sociological factors. And what is expected of men in our culture?
They'll be brave, strong.
Brave, strong, suck it up,
Don't cry.
don't cry,
No feelings.
no feelings.
Solve problems, don't talk about.
Yeah. Solve problems, don't talk about them. All those things are messages that boys and men have in our culture, and in many other cultures, but I know this one the best, so I'll stick to it. So you can see why that would make it much more difficult, because men are expected to protect themselves. They're supposed to be strong. We said brave. And so what's been the typical pattern that we've learned about victimization?
Stagnation.
Male perpetrator, female victim, right? And that's what's been studied the most. And so it sort of ascribes these roles. So for a guy to be a victim, what does that mean?
He's weak. He wasn't strong enough. Less of a man.
It's kind of
It
feminine.
feminizes.
Feminizes him, yeah.
Masculine.
Feminizes him, makes him not strong, not able to take care of himself, not a real man, of course. So, you know, all those messages in our culture are really strong, and they really affect boys and men. And interestingly enough, in male sexual abuse, there's a lot of evidence that the results are sort of additive. They've studied the results on boys, on adolescents, and on men. And a lot of times, by the time boys get to be men, the effects are even worse. There are these effects as boys, the effects increase in adolescence. Why do you think they might increase in adolescence?
Because they're going through a change.
More expectation, more of the male expectations. of
Peer
something
pressure,
less
all
strong.
kinds.
Yeah, there are more male expectations, and there are more changes and more difficulties just in living as an adolescent. Nothing to do with whether you've been abused or not. So all those things come together, but they sort of potentiate the effects of the abuse. So, and then that continues, so that some, again, are even increased by the time a guy meets manhood. So, some of the research findings, again, let me say, for therapy, why do they come for therapy before I get to read further research? Why do you think most of the guys come for therapy?
So they can try to process what's going on with them, and get it out to somebody that wouldn't judge them, maybe?
That would be really nice.
That would be
the
nice.
reason they come for therapy.
For anger.
Huh?
For anger?
For anger,
Addiction.
for depression, for addiction, for relationship difficulties.
Yeah.
Those are the most common things. That's the ideal one, Jeff, that we'd like to have them come to therapy for. And even a lot of women don't come to therapy for that reason, although there are many women who do. But just take a look at our population here at Sovereign. How many guys have had trauma and abuse in their background.
Most of them.
Really high percentage, huh? Absolutely, very high percentage. And this, we've just got one little section here. And as I've said to you guys before, 85+% of addicts have some kind of trauma in their background, not necessarily childhood, but some kind of trauma in their background. So some of the characteristics that are common to both men and women, and some were mentioned that I just went over, but also fear or anxiety, depression, difficulties at school, anger or hostility, inappropriate sexualized behavior. Whenever you see a child with kind of provocative sexual behavior, what do you want to look for?
Child abuse.
Child abuse, yeah. Yeah. And they have more runaways, more delinquency. And as adults, they have more sleep disorders and night terrors, substance abuse, suicidal behavior, self-mutilation. And self-mutilation, both males and females. Eating disorders, same thing. You know, that's another thing that was thought for years and years. Eating disorder programs were composed of what?
Women.
Women. There are lots of guys with eating disorders. Most trauma programs have been composed of women. And there are lots of men who've been traumatized. We used to have a trauma program at Las Encinas Hospital back in the time when insurance let people stay long enough to get some kind of treatment besides medication. And I started and ran that trauma program. And actually, it was a mixed male and female trauma program. And we had more women than men, consistently, but we did have men. And it was very helpful to both the men and the women. The men to see, you know, how damaging it was to the women as well as to them, and for the women to see it's also damaging to men. You know, there's also this sort of, it's erroneous idea, but idea that boys, adolescents, not children, but adolescents, do well being initiated by an older woman into sexuality, or an older guy. Is that true? It isn't. And that misconception is still very rampant in this culture, and in lots of cultures. I'll use a patient of mine as an example, because I came to this before I read about it. So this patient I had quite a number of years ago, and he was referred to me by a criminologist who was working with his attorney, because he had a legal case, and he was arrested for pinching women's bottoms. And so obviously they figured he needed therapy, so they sent him to me. And he was Hawaiian, and he had brothers and cousins, and he was the youngest. And they decided, the brothers and cousins, that he needed to have an initiation into sex. And so they hired an older woman, not older, but you know, certainly he was like 15 or 16. She was probably 30. And he went, and when he was there, he was scared. And he didn't want to do it. But he was more scared of the ridicule that he knew he would get from his cousins and brothers if he didn't. So he did. And basically, he had all the symptoms of someone, survivor of childhood sexual abuse. And most people would look at that and think, well, he volunteered and he went and all this stuff and it was arranged and so forth. No, it still had that effect on it. It still had that effect. And one of the problems with the picture that we've worked with for so long of the male perpetrator and the female victim is that not only does the male victim get neglected, but so does the female perpetrator. Because there are, you know, men and women are perpetrated upon by both sexes. It's very confusing to a child. Sexuality is coupled with what?
Love.
With love, with attention, with, but also with, maybe I'm not doing something right, maybe this isn't, not okay. Maybe their mores are really confused. Because, and they get lots of times gifts, sometimes money, which gets associated with sex. So they associate caregiving and with sexuality. And how many adults have you seen who are confused about that? How many men and women are out looking for sex to get love? Lots of them. Lots of them. And that's why we have Sex and Love Addicts Anonymous. We have Sex Addicts Anonymous, but we have Sex and Love Addicts Anonymous. Sex Addicts Anonymous is composed mostly of men. Sex and Love Addicts Anonymous, there are a lot of women too. Although you always have to watch things, because I've heard of guys going to one of those meetings
Yeah.
looking for women. Leaving the SAA meeting and going to the SLA meeting. So it's not that, and it can happen both ways. It can happen both ways. Men are not the only perpetrators out there. And that's the way it's been looked at for a long time. So there's really some classical conditioning, you know, the pairing of things that happen, the getting attention and the getting love and the getting, but also sometimes of being hurt. And what happens when someone remembers being aroused?
Guilt.
Guilt,
Shame.
yeah, guilt. Yeah, because by this time they know that that wasn't okay. Okay, this adult realizes that childhood sexual abuse was not okay. And who do kids blame? Themselves. And who does society blame?
Well, if it's a man, they blame the man, the perpetrator, but if it's a woman, they blame the
We're still blaming the victim in lots of cases, right? I don't mean everybody is, but it's still out there.
The way she's dressed.
Right, right. How tight's her sweater, how short's her skirt, you know. This is, I'm not a fan of reading things, but I am going to read a couple of things to you because they're just astounding. In 1849, the Texas Supreme Court rules in favor of a father who allegedly incested his daughter. The court cannot conceive that incest occurs in this day and age in the United States of America.
Wow.
Well,
That was 1849.
look at Freud too, right? With women blaming them or saying it was a fantasy or,
Yeah, Freud came around later, but the damage was done.
right.
In 1962, there was a Rene Guyon Society. Their slogan was "Sex before 8 or it's too late." And actually, we didn't start really looking at some of this stuff. We started doing the research in the 70s, and guess what instigated that?
Sexual revolution. I don't know.
Come on, guys.
Hippies.
The women's movement.
Okay.
Where are you you women, come on.
Laura Steinem, sorry.
That was the height of the women's movement in the 70s, right?
Is-
And that's when they really started investigating childhood abuse and especially childhood sexual abuse and the effect that it had. And there really hasn't been an equal movement for men. I wrote a paper in graduate school entitled "The Subjugation and Emancipation of Women." And towards the end of the paper, I talked about the need for this in men. Not for the same things. I mean, men have traditionally made more money, had more power, those things. But in what ways have men not been emancipated? Emotionally, for one thing. And so more women would have emotional problems because men didn't have an outlet for them, so they had more heart attacks and stuff like that, because they didn't deal with the stuff. Of course, now that there are more women professionals who are imitating men, these things are increasing in women also. So, and, you know, what, they really started looking at stuff and we started treating some people. And like I told you guys, I was actually a pioneer in this area. Accidentally. I mean, the only reason I started specializing in trauma was I got all these women, survivors of childhood trauma, for patients. And there were no books, no workshops, no conferences, no nothing. There was nothing. In the early 1970s, there was one book, Susan Forward's Betrayal of Innocence. And then one of my colleagues, Karen Meiselman, I wrote a book on incest in, I think, 74 or 75. But believe me, when you go into a bookstore now and see all the stuff and you see all the advertisements for conferences and stuff like that, it's unbelievable that, you know, that many years ago. Not that that was yesterday, but it wasn't in the greater scheme of things a long time ago. And we didn't really know much about it. So, and to this day, even though that research really exploded in the 70s and has continued with women, and not till just recently for men, how much training do we have in graduate school? How many of you had a course in trauma? Okay. How many of you had more than one? See? How many had a course in addiction? How many had more than one? So, even though this area has been exploding, both trauma and addiction, we haven't really provided adequate training for, and that's not just true. Right here, we have, you know, psychology people and MFT people. It's also true for psychiatrists, LCSWs, everybody. In fact, in the research, they found that the two groups that had the most training, and I'm not saying they had lots of it, but had the most training, were social workers and cops. So a lot of times cops have had more training than we have. So another thing which happened, and this is more in the days that you guys can remember, because this is 1998. Brian Tromovich and Bosserman reviewed 59 studies on the effects of childhood sexual abuse. They did a meta-analysis, assumed properties of childhood sexual abuse using college samples. The authors contend that researchers of late have greatly overstated the harmful potential of childhood sexual abuse, and that the sexual abuse of males does not correlate with negative effects or maladjustment.
Wow.
Further, the authors encourage researchers to study a young male's appraisal of his sexual encounter with an adult. In doing so, investigators would likely discover that such an encounter would not constitute childhood sexual abuse, but rather be viewed simply as adult child sex. Their article will come to be employed by a number of defense lawyers in their quest to minimize the effects of child sexual abuse, and by numerous pedophile groups in their fight to lower or rescind age of consent laws. That hardly seems possible in 1998. I mean, yeah, 1849, I went way back for that one, but even that was weird. But in 1998,
Right.
this is just.
Right.
And actually, in 1975, in the textbook of psychiatry, they verified that the incidence of childhood sexual abuse was 1 in a million.
Wow.
And
That's
what
like
is-
1 out of 5 or something. right?
And what is it? It's 15% to 25%. And we used to say that it was 1 out of 3 to 4 females and 1 out of 5 males. We don't think that's correct. It's probably pretty equal. And the big problem is reporting. And not all women report by all means, but fewer men report than women. So we've still got a long ways to go, because basically we've really, as a field, as clinicians, reinforced this attitude also. This attitude that it's not so significant for boys and probably not so harmful, and they don't have these effects. Because actually, as professionals, we're not immune to social stereotypes. We'd like to think we are, but we're not. So still, there are the thoughts that it's less damaging and less frequent. So today, there are a lot of male survivors that struggle in silence, secrecy, and shame. And it's really shameful that that exists with the knowledge that we have now. Because even though the knowledge is later for boys, it's been around for the last 40 years. Not as much in research and not as much literature, but it's been out there. This is a very good book, by the way. It's written by Joseph Spiegel. And this is 2012 edition. He did one in early 200s, 205 or something like that. And he's really done a good job of looking at the research and of coming up with, it's called SAM, Sexual Abuse of Males, the SAM model of theory and practice. So I'd recommend any of you that are interested in working in this field that you try reading this book. Also, guys, besides the things we've already talked about that they worry about, they are fearful of being considered deviant if they've been sexually abused, or feminine, we mentioned, or gay. And I have worked with a lot of guys, as well as girls, who've had sexual abuse, and then the adults, more with adult survivors than with the children themselves. I've worked with adolescents and adult survivors. And the boys, the adolescents or men, I've never met one who was abused by a male who didn't worry about his sexual identity. And certainly some people who were abused by males are gay, and that's fine. But men who aren't, are still concerned about sexual identity. There's what they wonder underneath, and they frequently won't say this, and sometimes you need to ask about it. They wonder if there was something about them that they didn't know that made them attractive to men. So again, it's another way of blaming the victim, right? Something in their behavior that elicited this behavior in someone else. Now, he took a look at the characteristics of the typical perpetrator for boys. And these are some of the characteristics. More frequently from a single parent home, more frequently from a home in which there was criminal activity and part of one or both of the parents. Drugs in the home. And sometimes inappropriate sexual activity in the home. Increased sexual abuse survivors in the home. Unstable home. And like if it does happen to a boy, then they tend to isolate and blame the boy. So there's a lot of stuff that happens from the, so there's not just the childhood sexual abuse, which is so damaging, but then there are all the reactions to it, which just increase the damage. And therapists inadvertently do that lots of times. They don't ask appropriate questions. Just, there's a lot of, remember the McMartin case? A lot of stuff came out there about what questions are okay to ask and what questions aren't okay to ask and stuff like that, because we can inadvertently, and then we were accused, that's the other thing that stopped some of the research for a while and stopped some of the treatment for a while, unfortunately, was the big false memory syndrome that was going around. And so a lot of therapists didn't want to treat, right? They could get sued. Well, I'll tell you, I never stopped treating, but I did stop doing one form of treatment that I used, hypnotherapy. It's easier to accuse someone who's doing hypnotherapy of implanting ideas, which of course I never did. I mean, I just learned, like I said, we didn't have a lot of things to learn from, so we all kind of learned by the seat of our pants and our mistakes and stuff like that, but we learned. And something I would never do was suggest, like I've had patients tell me that, oh, my therapist thinks my former therapist thought I was sexually abused. And when someone says that, I always sort of cringe. I mean, I don't do it on the outside, but I do it on the inside. Because what does that say?
You're not fully endorsing it, they're just saying, well, they thought that.
Well,
Yeah.
they,
It's their idea.
no, they
Yeah,
thought it,
exactly.
but then that suggests something.
Right, planning.
You need to not suggest anything. You want to be really open to hearing everything, but you need to not suggest. I've had patients that I know were abused. I never said that, nor would I. But I could tell by all their symptoms that they had some kind of abuse. And a lot of times people try to figure out what's the worst kind of abuse to have. And sometimes it's emotional abuse. Sometimes that can be worse than anything. But they're all really bad. They all really have detrimental effects on children. So, let's take a look at any other things that may happen as a result of childhood sexual abuse.
Relationship problems?
Relationship problems, absolutely.
Sex addiction.
Sexual problems. And sexual problems can go various
Extremes.
ways.
Yeah.
They can be like have trouble having sex at all, or they can become sex addicts. And any place in between. What does it do to trust?
That's the way.
What does it do to intimacy? And aren't those two of the really important things that we all need to? They've also discovered in a lot of cases, it can be related to the attachment. Yeah. And perpetrators are very good at picking what children to pick. I was talking to a cop one time, and who told me that a perpetrator that they had arrested, childhood sexual abuse, offered to go down to the school grounds with them and point out the children
Wow.
that he would pick.
Did you see that movie that was just out about the Catholic Church?
No, I haven't seen that one
It's
yet.
really good about
I'm
the
planning to see
sexual
it.
abuse.
And actually, that brings me to the point I wanted to mention about all the stuff that happened in the Catholic Church. That actually helped boys, the stuff, that boys' sexual abuse. It helped bring it into the media, bring it into our attention, bring it into research, bring it into treatment. And in my trauma group that I had at Las Encinas years ago, we had been referred a priest who was a perpetrator. And one of my psych assistants saw him for individual therapy. And we had a meeting with him, his psychiatrist, his therapist, and of course with him, because he was molested as a child. And so he wanted to be in the trauma group. Well, we knew that there was no way he could be in the trauma group with total honesty. Because the women in the group would be just so blown away they couldn't work with him. So he agreed to work with his work as a perpetrator in individual therapy, and in group, he worked on his own abuse, childhood sexual abuse. And this guy made tremendous progress. And nothing really could have taught him more than what he saw in that group. The effects of abuse on the other people in the group. And so this was an interesting project, which was very successful. He was a very bright guy and a very, very high functioning guy. Fucked up guy, but, bright and high functioning. And so he could keep a commitment, like he wouldn't talk about that in group, and he would talk about it in individual therapy, so that he got treatment for both things. But it was very effective. And then the Alamo Hospital, unfortunately, the program has closed. But they had a program for both victims and another program for perpetrators, and they were in the same general area. And they had certain groups every week with both the victims and perpetrators together. And again, what they learned from each other, they could have never learned on their own. Dr. Seeley, who psychiatrist who ran that program, was very good, and it was, I think, the first, I don't know that it's the only, but I know it's like probably the first in the country. And it was successful, but I think probably the reason it didn't continue is because a program like that, most of the time, insurance won't cover, which is really sad, because what better could insurance money be used for than to ensure that we don't keep having a lot of perpetrators running around the country? But they don't look at it that way, and so a lot of it had to be cash. I sent a case of mine, a legal case, who was arrested for sexting Everybody know what that is? Okay. And it turned out that one of the young women that he was sexting with on the internet was 17. And that's how he got arrested. So he was not a child perpetrator. I mean, it's, the laws are different for a 16-year-old, 17-year-old, but it's still not okay. Yes?
I just have a question about, okay, so you say with the victims and perpetrators having groups together and they can learn from each other. What does the victim have to learn from the perpetrator? That's my question. What is it?
That they're fucked up human beings.
Well, we know that already. I know that already. I know that.
They learn how it happens and how a lot of times they were victims. And that's where it came from. Does that make it okay? No.
No.
It doesn't make it okay at all.
Restorative
But-
justice model,
Huh?
sounds a lot like the restorative justice model.
Yeah, it helps people understand. And when people can make more sense of things, it's easier for them to work through them.
I wanna know about the mothers, you know, when the child is abused and the mothers who turn a blind eye, or the father, you know, that's happening in the house.
Okay, let me finish
Yeah,
about
no,
this patient and then
sure,
I'll go back to
sorry,
that. So this patient, turned out, was sexting with a 17-year-old and got arrested. And they were really determined to make him a sex offender and send him to jail. And his attorney referred him to me and we worked together on that case. And he wound up not going to jail and not being a registered sex offender. He did have consequences. He's on probation for a long time. He has to be in therapy for years. He had to do community service work, and I'm laughing, not about related to the seriousness of the situation, but this is a guy who is a businessman. Very influential, very well-off businessman, who probably had never done the kind of work you do in community service in his life. And he did it, and he didn't complain about it, and he was there on time every day, and he worked right alongside of everybody. So he really took it seriously, and I'm continuing to see him in therapy, and there have been no relapses, no nothing. He's been very serious about his recovery. He goes to, it's been a couple of years now, and he goes to SAA meetings 5 to 7 times a week. He has a sponsor, he has commitments. He also, I send him to this program at Del Amo, and then I send him to another program, outpatient program, and there's a men's group from that program. He goes to that every week. So there are people who really seriously want to be okay. And like I say, he wasn't a seeker for children. Sometimes it's not easy to tell the difference between a 17-year-old and an 18-year-old. But, which again, doesn't mean it's okay, but at least he's really done this stuff. As far as people turning a blind eye, a lot of times it's because they can't admit it. A lot of it's denial. Just like that ridiculous thing from 1849, where it said they couldn't believe that this kind of behavior could happen in this day and age in the United States of America. Well, people don't believe this can happen in their family. I mean, years ago, like I said, even back in 1975, they were saying it was 1 in a million. And then I remember when I was young, that we sort of knew it existed, but it was like, had to be some really low-class family, really. We had no clue because none of this stuff was known. So it was just sort of vaguely known, so people couldn't believe it. Yeah.
And I think the experience for a mother is so painful that, you know, even, I had a client and we just went through this with somebody who was a male and who was abused by another male when they were young. He recalled telling his mother didn't recall hearing that from him. But you know, we worked it around to it just being too painful. She couldn't accept it.
Mm-hmm. Right, that's right.
I remember when I had my client last month who left, Shannon, and she was saying like how her mother would make her go into the grandfather's room and stuff, like,
Yeah, some mothers are complicit. I have a mother who married her daughter's abuser.
right?
Patient right now. She married her daughter's abuser.
Well,
They're
yeah.
married right now.
There are really crazy people out there.
Yeah.
But just the usual is denial for it's too painful, or they can't believe it could happen in their family, or they can't believe that this guy
We do that.
or this woman would do that. It's just not, yes, James.
I was gonna say, there's some victim blaming too, like I treated a family where the son had been sexually abused and, the parents seem to like really, sometimes it seemed like they almost blamed him. So
They
they
get
would come
jealous
to
of
me
the
and
kid.
say that they thought it was abnormal that he was masturbating and stuff. They thought he had, that maybe somehow he attracted this because he asked his cousin questions about what certain sexual acts were, and his cousin decided to show him rather than say that that's not something I wanna talk about or whatever, he didn't have the boundaries, but beyond that boundaries.
Yeah, I think it was before you were here, we talked, that's one of the characteristics of some of the families,
They were, yeah, they
is
were
that they
almost punishing
blame,
him.
they isolate and blame.
Or call them liars.
Oh, yeah,
Right, yeah.
yeah,
You're a liar.
Yeah, you're a liar.
Stop lying.
yes, yeah, that's the other thing, the other form of denial that's used is actual verbal denial, where they say you're lying. And it makes a huge difference, when a parent responds appropriately. I mean, it doesn't wipe it all out, kid still needs treatment, but, it makes a huge difference, huge, they really feel, what do they feel?
Not her.
Heard and protected. I mean, they may have felt unprotected because that happened, but they can see that someone is gonna make every effort to protect them.
Do something about it.
And worthy.
I think we've
And-
been seeing a lot of inappropriate parental responses here, and then they turn to substance abuse.
Exactly.
Yes,
Like the being jealous of the kids for that, like, it's very hard for me to wrap my head around
and
I've
remember,
seen that
that. I
too.
understand.
boys do that even more than girls, because got feelings anyway, right? Any kind of feelings. And so if they start having some painful feelings, they quickly anesthetize them. So that, but there are a lot of women who have been abused who go to substance abuse too, but there are more men because of, so in the treatment of childhood sexual abuse in males, we have to keep in mind that we're treating men. And how well do men do at feelings? Not so well, huh? Even though they haven't been, even when they haven't been abused, they don't do well at feelings. And so we have to, a lot of times, really teach them. And we have to hear their narrative. That's really important. And it can be helpful to have them do the narrative in the first person, present tense. It really kind of validates the experience. And we really need to, this is unfortunate but necessary, sometimes the cognitive and the emotional are dissociated. And unfortunately, they have to become associated to work through the abuse. And you've heard, I'm sure here, people talk about childhood abuse, like, gee, the sun's shining today, it looks like it's gonna be okay.
Women more than men.
Yeah, men don't talk about it at all,
No, the women
but
do.
women will just recite it, like, you know. And
We deserve it.
And sometimes, I mean, a lot of people now who've been in therapy much have learned a little bit about dissociation. So they kind of get it a little bit when we talk about dissociating and losing time and stuff like that. They really don't know about dissociating from feelings. That they can have the information cognitively and their feelings aren't there. And so that's something that we have to do for both men and women. First, we have to teach men what feelings are. Secondly, how to express them. with women, we have to teach them a lot of times to associate the feelings with the cognition before we can do a lot of other treatment. A high percentage of males who were perpetrated upon. And this is not always true, but it tends to be a little more aggressive acting out against the self with women and against others with men. Not always true, but. Need to really explore fear and sadness, fear, anxiety, and sadness. And the other thing the guys get not only worried about sexual identity, but a lot of times they turn towards hypermasculinity. Excessive heterosexual activity. And they need a lot of reassurance that they are no less masculine because they were abused. The victims can be males as well as females. And it doesn't mean if you're a victim that you're feminine or that you're gay or that you're less of a man. One of the really vital characteristics in the therapist who treats, we could say both males and females, but especially males, is empathy. And remember, right now, and we talked about this earlier today in our postdoc group, there are many more women in this field than there are men, right? So, is empathy a little trickier?
No.
If you're a woman, do you know what a guy feels like?
No.
No. Not that we know what anyone else feels like, totally. I don't think you can ever, I rarely use the word, when I'm working in therapy, I rarely use the word I understand. Because I don't think it exists. I think sometimes we have some understanding. I do rarely use the word, but most of the time, I don't think I can totally understand, another person's feelings or plight or experience or behavior. So, and when you cross sexes, then it makes it more difficult. Because at least I, as a female, have a better idea of how females, because there are some characteristics that are general, than I do for males. Now, just a second. One thing that helped me a lot is I had a husband and 3 sons and a male dog. I was really outnumbered. So I did learn something about male characteristics. Yes, Ed?
Something I've seen that's interesting is when people come in and will request a therapist, many males who've had an incident will actually say they only feel comfortable talking to females about it. And females also only feel comfortable talking to females, so.
Yes, that's another misconception lots of times. We know that lots of females ask for a female therapist when they have, especially when they have sexual abuse if it was perpetrated by a male. But as Ed said, a lot of people think that men are going to be more comfortable talking to men. Not true.
It's also not true that women are always more comfortable talking to women.
No. So I said, a lot of times it's if the perpetrator were male. But for, why do you think that men are more comfortable talking to women?
Less emasculating.
Don't feel shame.
Less emasculating. Talking to another man, it would be emasculating, like a weak
Pride.
It's an attachment.
What would you say? Yeah.
emasculating. It's emasculating to tell another man that you were molested or raped by a man. Easier to tell a woman.
You kind of tend to think that the men are the ones who are sitting in judgment of your masculinity
Yes.
when you're.
Yes. And there's more competition
Yeah.
with a male.
Yeah.
And you can't compete if you were sexually abused. It's a bullshit, of course, but I mean, that's a feeling. And yes, more understanding, we're still looked at, certainly not, frequently not true, but we're still looked at as the more nurturing. And we are by nature, I mean, that's one of the differences between men and women. Women were kind of supposed to be nurturers and men are supposed to be fixers, which sometimes causes us trouble. But fixers, men are fixers. That's why women have so much trouble with their relationships with men. Because what do we want?
An ear.
Nurture.
An ear. We want somebody to listen, somebody to maybe validate our feelings sometimes, or at least be able to recognize that they heard them.
Yeah.
And what do guys want to do?
Fix it.
Fix it.
Solution focused.
This represents you stop having this
Yeah, this is, and let me tell you, this is what I deal with a lot in couples therapy. I don't know how much couple therapy, some of you have done it, some of you haven't, but that's at the basis of a lot of the misunderstanding between men and women. And I've said before, I can have a couple sitting on my couch, and the woman is complaining, because she's, every time I talk about my feelings, he tries to fix me, and I can't stand it.
He just doesn't listen.
And the guy is saying, well, what am I supposed to say? What am I supposed to do? And the woman has said what she's upset about. So I said, God, it sounds like that feels pretty shitty. And she says, and the guy says, I couldn't say that. But it is. It's fine to say. It's what somebody wants to hear, just to know that they got heard. But, you know, we're socialized this way, so we have to learn. You know, I had a lot of patients who got a lot out of that book, Men Are From Mars and Women Are From Venus. I mean, not that there's any book that I think is like the thing for everybody to read, but there's definitely, and I had one couple that they took turns reading it out loud with each other and found it very beneficial. Because it gave them some, especially the guy, gave him some insight. Yes?
Then I went to see Pat Allen, and she says it's the opposite, like men are the nurturing ones.
I mean, evolution would not,
No, but
no,
no, but that's what she said.
I know, yeah.
Evolution.
But it's not just evolution.
Just keep this in mind, you have to think of evolution. Yes, Judy, you do have to think of evolution. How long does it take for someone to ejaculate?
Yeah, a second. 2 minutes.
And how long does it take for a child to be able to survive on their own?
Yeah.
It's an evolutionary absolute. They need nurturing. And until recently, women have been the caretakers of children. That's changing now, which I think is very positive. In a lot of families, people are both doing it, or whoever has a better job, the other one's doing the child, and wants to do the child care and the home and stuff. And, you know, I've had a lot of guys sort of laughingly and sheepishly say, I'm a house husband.
Yeah.
How's that?
They should not have to say that sheepishly, huh? No. No.
It's hard work.
It is hard work.
Yeah.
Just like that old saying, men work from sun to sun, women's work is never done.
Yes.
But now that's changing. Okay, so it's important for the therapist to be very empathetic. It's important for them to be, the most important thing in therapy, again, in all therapy, is the I-thou relationship. I don't care what system of psychotherapy you come from, that's the most important. And the therapist needs to have relational availability, emotional responsivity, and consistency. Those are really important characteristics of the therapist who's working with the child with sexual abuse. We need to acknowledge a history of childhood sexual abuse, explore the dynamics and the effects. Like I said a few minutes ago, associate the cognitive and the emotional. And then again, I already mentioned that, that you need to, let them tell their story. In the first person, present tense. And remember that a big part of the work with adult survivors of childhood sexual abuse is not only trauma work, but what other work? Grief and loss. Grief and loss. Because they've had huge loss, right? And they need to grieve that loss. It's, most recently, a patient of mine was abused by her father sexually. Actually, technically her stepfather, but he was her father for all of her life. And so she brought it up, had not worked through it at all at any time. And so we came to a point where she was willing to have a session with her mother. Because her mother and father were still together. Her mother said that she really, I don't know how she did this, but not something I could do. She felt like she really told him what's what and what he had to be like and so forth, and that he never did anything again. When I say I couldn't do that, because I couldn't stay with someone who did that.
Yeah.
I hear you.
I couldn't and I wouldn't stay with someone who did that. Her mother came in and it was a really pretty good session. Her mom, you know, let her know how sorry she was it happened and stuff like that. But it was like, you know, she has the hardest time with Father's Day and with her father's birthday and stuff. She still tries to get some kind of card that's not total bullshit. You know, stuff like that. It's really hard. And it's really hard for her to have a lot of relationship with her mother. So even though the family still like gets together for holidays and for different things and stuff like that, and she has a relationship with her mother, she even has some sort of relationship in the sense that she goes over there once in a great while with her father. But that's very uncomfortable, and she too, although she felt positive about her mother's response in the session, still doesn't feel positive about her mother's behavior in that situation. Okay, questions? Comments or whatever? Anybody ready? Everybody ready now to go out and work with boys, both men?
Yes.
What's the first thing you have to do?
Listen. And tell their story.
You have to be empathetic. And what do you have to do? You have to teach them about feelings. They can't express them if they don't know how. And they've learned for years not to. Yeah.
Ask you, if somebody, other than just saying, well, go see your therapist, if somebody is like, you know, having a conversation, they are struggling with this fact and they're trying to get you to tell them, or, you know, they're expressing their feeling like, this makes me feel like less of a man, or, you know, was there something wrong with me? How do you address that in terms, what sort of language do you use that's least harmful?
It's
While you're talking
important
to
to
the
use the same
therapist.
kind of language that the patient uses.
Okay.
So that's a good question, thank you. In that case, as somebody who was a non-therapist hearing that, I would say, yeah, you know, that's the way most guys feel that were molested. They're fearful about their masculinity and they're not sure that they, you know, whatever. But you know, that's basically something that would be probably helpful to see somebody, a counselor who specializes in that could help you change those feelings.
Yeah.
Yeah,
I had a client recently in session while describing her narrative, find herself really distraught or being able to determine how far sexual abuse went with the father. And she turned to me directly and she asked me what I thought about her being stuck with trying to determine whether she went all the way with him or not. And I found myself struggling on how to respond to her with those types of questions, and besides from just giving her reflective statements, because she pulls for each session, but she's really struggling with that. How would you handle that kind of a question?
okay, the way I usually handle a similar kind of question to that is, well, I like my patients to journal, so I encourage them to journal, and I encourage them to not try to remember anything. I always say, what needs to come up will come up. Sometimes you need to give it time. And it's better if you don't try to remember things. Just, you know, journal your feelings, and if things need to come up, they will. And that sometimes they come up when you're more ready. Yeah.
Since working here, even I've had a couple men disclose to me that they were sexually abused by a caregiver at a young age. At this point in time, one of them was dead, so like it wasn't reportable yet, but my question more is, they say this a lot of times early on when I meet them, and then they'll acknowledge that it was wrong that it happened, but sometimes they report that they feel guilty for feeling that way, because of, like, maybe when they share this information with other men, because of the way men are socialized, other men have said to them, like, oh, I would have liked that if that happened to me.
Yeah.
And that seems to be a struggle for them, to dismiss that belief system that's been ingrained.
You have to help them work through that belief system, which is basically bullshit.
Yeah.
You hear a lot of people say that when the
Yeah.
stories are on the news about a teacher. I would have loved my teacher.
Right.
It's like, no, you
Right,
Yeah.
right. And who do you hear that from?
Men.
The guy.
Men. Do you hear that from women?
No.
Usually not.
Yeah.
Usually not. Men say that, but it's bullshit.
Yeah.
And they're very careful in teaching. Gosh, my husband years ago, probably 40 years ago, was teaching in a school that I guess one of the girls had, 5th or 6th grade, had accused someone in the neighborhood of molesting her. So one of the administrators came, my husband was substituting, and one of the administrators came out in the rain to warn him not to be alone in the classroom with that student. Not that he would have been anyway, but they wanted to be sure,
Yeah.
because this student had already accused a neighborhood person who had been a caregiver. Yeah, and they didn't know, because teachers, if they are accused, they are instantly put off.
Yeah.
They're still paid, because, you know, everybody's guilty, you know, innocent until they're proven guilty, but they are taken off of school immediately. So, yeah, you really have to help them, Sheena, because there's so much of that out there, and you know, that's part of the bullshit about masculinity that's in our culture.
I know that there are a couple of patients here who were really able to support each other on the track with the MH men, because their group happens to be so small. It was a safer space for talking about that, and because they were able to speak to each other about it kind of in private, I think they helped each other restructure some of what they began to believe about themselves.
Trauma group is tremendously helpful. Trauma survivors, as far as I'm concerned, I would say they should always be in a group. They should have individual therapy, but they should be in a group also. Because if you get a group of trauma survivors and the group develops, especially like an outpatient group that goes on for a while and people develop real relationships, they are so helpful to one another. And they so feel not alone.
They're very, like, the group, a trauma group, and feels very strong by the time you've had a couple of sessions. Like, the group feels very forceful.
Yeah, yeah. Remember, 4, 5, 6, 7, 8 people can be more supportive than one. Well, thank you, guys.
Thank you.
Thank you.